So before we start, let me say that this is part of the PrEP month that we are organizing, part of the Cyprus PrEP Point that we launched in May 2025. And the idea is to have members of the community joining community sessions and discussions around PrEP. After the approval by the Minister of Health of the proposal for official access to PrEP in Cyprus that was submitted by the National AIDS Committee. We started the Cyprus PrEP Point in May in order to give a frame to the support that we have already been giving to people who are using PrEP under their own and personal responsibility, as PrEP is not officially available yet in Cyprus. And we hope that the Cyprus PrEP Point is going to continue doing that when PrEP becomes officially available. So the Cyprus PrEP Point is the Community Information and Empowerment Center to provide information and support and guidance to people who choose to use PrEP. And in this session and in this community meeting and discussion, we have our very good colleagues and friends from AIDS Action Europe. Thank you, everybody who's here, and thank you, Ferenc and Nina and Ismar, for being here. It's nice to see you again. Like I said, I'm going to switch off my camera like the rest of the people, and then we will give you the floor to be able to go ahead with the presentation and present the work that AIDS Action Europe has been doing around combination prevention. Also, I have to say that AIDS Solidarity Movement is a member of AIDS Action Europe since 2018, if I'm not mistaken, or maybe 17. And a very active member, and the participation in the network in AIDS Action Europe has helped us grow a lot, get a lot of information, grow in terms of our advocacy, knowledge base, and we've run a lot of programs together as well that have helped us through these years. So thank you very much. Ferenc, shall we start with you?
Yes, thank you, Christos. Hi, everyone. Good evening to Cyprus. This is Eurovision calling. My name is Ferenc Bodinski. I am the coordinator of AIDS Action Europe, a network of 270 organizations from all over Europe and Central Asia. We are based in Berlin, Germany, and we are hosted by Deutsche AIDS-Hilfe. I'm here today with my colleagues Nina and Ismar, who will later speak a bit about our work, what we are doing, focusing on PrEP and also a bit on PEP, and then on community engagement and also chemsex. So as Christos mentioned, AIDS Solidarity Movement is one of our members, and membership is free to all civil society groups working in the field of HIV and who endorse our mission and vision. You can read the mission and vision statement on the slides. I won't go into detail just to save time for more discussions. And I thought that we could also look at our strategic objectives, because as Christos was mentioning, the example of AIDS Solidarity Movement becoming an active member of AIDS Action Europe, that's a very good example of how your organization, AIDS Solidarity Movement, has been part of all of our strategic objectives, almost like being we managed to support your activities, your advocacy activities. We engaged in capacity building exercises with AIDS Solidarity Movement, and also try to do networking and building relationships within the European HIV field. And your organization is a very good example of an active member. And down there you can see our core thematic areas, and you can see that most of these core thematic areas also overlap with the combination prevention work that we are doing. And in combination prevention, I just wanted to mention two things before I hand over the floor to Nina. And that is that we hear a lot about the HIV treatment targets, the 95, 95, 95. 95% of people know their diagnosis. Those who know the diagnosis, 95% of them put on antiretroviral treatment, and 95% of people on treatment have an undetectable viral load. These are all set in the Global AIDS strategy. The strategy is until the end of 26, but the targets are actually by 2025, so by the end of the year. What we don't talk so much about is that there's also another 95% target which focuses on prevention, and it says very clearly that 95% of people at risk of HIV use combination prevention. Now, combination prevention can mean many, many things depending on, and the strategy is very clear about that it should be appropriate to the person, prioritized individuals and also communities who are at risk. The prevention should be person-centered, and they should be very effective options. Now, pre-exposure prophylaxis or PrEP is a very effective option of combination prevention, one of the tools in our range of combination prevention options. And there are also very specific European targets for for reaching how many people should be on PrEP by the end of 2025. That should be 500,000 people in the WHO Europe region. And by 2030, which is the Sustainable Development Goal year, we should reach 1.1 million people on PrEP in the WHO Europe region. Now, unfortunately, I highlighted it here that in 2023, this is the latest data from ECDC, only 160,000 people were on PrEP in the EUA region. And I think that for this really underperforming when it comes to accessing PrEP for many people, Nina will tell you more in detail why this is happening. But I just want again to congratulate for your advocacy efforts on making sure that Cyprus is on the way to provide PrEP for anyone who needs that. That was from me. I hand over to Nina, and Nina, please tell me when I should flip the slides.
Thank you. Hello, everyone. My name is Nina, and I'm Project Manager at AIDS Action Europe, and I will be focusing and share the key findings from our work focusing on access to PrEP and PEP in the EU member states. Next one. So, as Ferenc mentioned, it's clear now that we are not really on track reaching the targets, especially the prevention one. And oral PrEP has been licensed in the EU by the European Medicines Agency for almost 10 years, but still it hasn't reached its full potential. So we decided to make this exercise and to figure out why and where are the barriers. So in 2022, we conducted this rapid assessment among our members in 26 countries in order to analyze the accessibility, availability, affordability, and acceptability of oral PrEP. So currently now we're also in the process to see if there were any updates or changes to the replies. So we'll try to integrate some of the new information as well. You might know that there is also the ECDC annual report on PrEP, but the difference of our report is that our data is focusing on community-based organizations and CSOs, and it provides a bit of a different experience and approach. Based on the data, we developed the report and the policy paper, which is based on the human rights framework. Next one. So if you scan the QR codes, you can access both of our reports on PrEP and PEP, and also in the clearinghouse, you can find the relevant policy papers. Next one. So based on the analysis, we classified the countries into three areas. You can go into the next slide. It's more or less yeah. So you can see we color-coded the map into red, green, and blue, and the ones with countries without any reimbursement scheme for PrEP, the ones that fully reimburse PrEP, and the ones that have co-payments or mixed systems in blue. So you might obviously see that there are some changes, and this is the good news that I'm happy to present, that Italy and Greece, in this meantime, they started reimbursing PrEP, and hopefully maybe by the time we publish the new report, Cyprus will change to the green one as well. That's next one. So we tried to come up with, of course, every country has their specifics and the specifics of the national health systems, but we tried to come up with the general findings that are really common for the countries based on their reimbursement scheme. So for the countries that have no reimbursement scheme, it was rather obvious that it was kind of common that they have unofficial access to PrEP, and pretty often this happens through online pharmacies. And the price online was commonly reported as €30. And in some countries, you can obtain PrEP with a prescription in pharmacies, and there the cost will be higher, something around €60. Although a lot of countries in this category reported this sort of unofficial access to PrEP, yet we have to mention that there is a missed opportunity for HIV, STI testing, diagnosis, also the check of kidney function, which is missing out in this online ordering way. One of the unfortunately bad example is Hungary, although a country which states it has universal health care, yet people tend to go to a private doctor to get prescriptions because of stigma and discrimination, judgmental attitudes, but also the PrEP is not reimbursed. And you have an option after you get a prescription and visit a private doctor and pay a fee to get to a doctor. And then you have an option either to buy it at the pharmacy for €130 or order online for €30. However, we also have a good example here, and it's one of actually the examples that we highlight for all countries, is in Bulgaria, where Sofia Checkpoint provides daily HIV STI testing and weekly consultations about PrEP with the infectious disease specialist who visits the checkpoint and also issues PrEP prescriptions. So it's basically an example of community-based service delivery. Next one. So the countries that reimburse, they also have some challenges as well, unfortunately. And one of those challenges is the restrictive eligibility criteria in the national protocols. Unfortunately, now not all countries really comply with the WHO guideline, and pretty often they do not include cisgender women, and also they have restrictive criteria where a person has to share their personal information that might not be willing to share. So another thing is that often the authorization to issue PrEP remains within specialized doctors. Pretty often it's infectious disease specialists. Sometimes it goes further to general practitioners, but it always remains among this clinics. And if it's infectious disease clinics, often they are concentrated in the urban areas, which again is a barrier for people who have to travel to these urban areas to get a prescription and an appointment. Another common barrier is long waiting time, because of if you have to get an appointment in one HIV clinic in a country, this also doesn't really improve the access. Interestingly enough, in these countries provide reimbursement, they at the same time tend to limit and prohibit the online access to PrEP, which is kind of a gray zone. But then this limitation restricts the access to other people who might not necessarily have the insurance, or to undocumented migrants. So we can move to the next one. The common findings to all countries is that there is limited accessibility to PrEP and PrEP-related services. concentrated mostly in bigger cities. And most countries do not really, there are a couple of countries that provide or have mixed methods and cooperations with the checkpoints, but still most of the countries do not have community-based PrEP service delivery. Also, some countries which try to make more inclusive and to make the criteria for doctors who can prescribe PrEP broader. They also allow some general practitioners to prescribe PrEP, but at the same time, the knowledge of general practitioners is not always sufficient on PrEP. And also, this creates the difficulties in ensuring the judgment-free environment. Also, there is a lack of, countries reported the lack of awareness-raising campaigns, and often if the organizations or the public health authorities provide awareness-raising materials, often they focus on young, educated gay and bisexual men. So that's why the coverage also remains focused on this population. And often we have, even in the countries with really great access to PrEP, but the access remains limited, and there are groups underserved who are foreign gay and bisexual men and women with migration background and sex workers. So at this very brief analysis of the new information that we got, there are some good and bad news at the same time. So the good news, as I mentioned, is Italy and Greece. And another good development then that several countries have implemented protocols and PrEP guidelines, such as Malta, Romania, but it doesn't necessarily mean that they commit to the funding. Another good development is that there are more countries that are trying now community-based delivery. There are several pilots and collaborations, including Portugal, but also Cyprus. The not such a good news is PrEP shortages, and they've been reported in the end of 2023 and 2024. Germany was pretty loud about the shortage, and the current shortage has been reported in Poland, Romania, and Bulgaria. Next one. So while I will not go through all of the recommendations, unless you ask me to, I will focus on the really main ones, as these are the really core recommendations that could enable and really improve other barriers to accessibility. So the first recommendation is for those countries without reimbursement script for PrEP to include PrEP medication and also PrEP-related services under the public health reimbursement scheme, and for all countries to establish and promote low-threshold community-based and led PrEP delivery. Next one. So here we have the full list of recommendations that you can find in our report and also policy papers, but most of them, they're really based on the key barriers that I mentioned earlier. So now we'll really briefly try to go through another exercise on PEP. And so we did a similar exercise in terms of access to PEP. And the reason why is that recently we've realized that there has been more and more attention, and we're happy that it's happening, advocacy on oral PrEP and PrEP in general. But at the same time, PEP got a bit forgotten, and this is also one of the main critical tools in combination prevention. And before I go further into the findings, I would just like to mention that HIV PrEP involves taking antiretroviral medications to prevent HIV after recent potential exposure, and it's very important, the time sensitivity of HIV PrEP, which has to be taken within 24 hours after exposure, but no later than 72 hours, and requires taking the medication for 28 days after. Next one. So based on our rapid assessment, the main barriers for the countries were the policy barriers, and some countries reported that in the national guidelines, the PEP access is limited to occupational exposure and to sexual assault. These countries include Hungary, Lithuania, Poland, and Bulgaria. And in those countries, but also others, this means that for other cases of exposure, this will require out-of-pocket costs. But also in countries where the countries with inclusive policies, for instance, Romania, access is limited in practice because doctors do not consider the sexual exposure or needle sharing as a good reason to provide PrEP, but it's also highly related to stigma and discrimination and judgmental attitudes of healthcare providers. So another similar to PrEP is the availability, which is often pretty limited to HIV clinics and emergency departments. Well, it depends on the countries. In some countries, it's only HIV clinics, and then it becomes almost impossible to access, because if you have one clinic in a capital and considering the time sensitivity and appointments, and travel times, it becomes really challenging to fit within this time frame. In countries where you can get it in emergency departments, you have often the lack of knowledge of healthcare providers working there. And also we receive reports that in some cases you might be able to get the PEP in emergency department, but you still need to get an appointment in HIV clinic for the follow-up. And this is where it's discontinuous. So that's why this is one of the main barriers for PEP to the long waiting times and in relations with the time sensitivity. And just one of the quotes and examples how hard it is for persons and community to get PEP and initiate the conversations with doctors is a quote from Greece. And the quote goes, "The doctor told me PEP was for promiscuous people. I felt judged and ashamed." So this kind of attitude does not really motivate to ask for PEP, the healthcare. And also the low awareness of PEP among key populations was also reported. While it was stated that the level of knowledge among gay and bisexual men is rather solid, but the knowledge among trans communities, among sex workers, and migrant communities is rather low. And the main recommendations that we have in this report is to expand eligibility beyond occupational exposure, offer PEP in community settings, pharmacies, mobile units, ensure that public health funding covers non-occupational exposure, train providers on PEP and stigma, and launch targeted outreach towards awareness on PEP. Thank you, and now we'll give the floor to my colleague Isma.
Thank you, Nina, and hi, everyone. I'm Ismar. I'm project assistant at AIDS Action Europe, and I'm in charge of organizing the AIDS Action Europe events. Before I start my presentation, I would just like to say that congratulations and thank you for giving us some good news in these times when bad news are quite common. So yeah, what I will be talking about today are our network strengthening and capacity building activities. I will give you just 2 examples. And as Ferenc said, we have over 270 members or member organizations, and we see our role as being able to provide a platform for the members to meet, exchange, and talk about their issues and good practice examples, but also to share skills among the members of our network. When it comes to network strengthening, I'm going to be talking about the European GBQ MSM networking meeting. And in the capacity building part, I will talk about 3 different activities regarding ChemSex. Next slide, please. The GBQ MSM networking meeting was originally organized yearly by Deutsche AIDS-Hilfe, which is our host organization since 2009. And it was conceived as a platform for networking and exchange for organizations and activists in Europe and Central Asia who work in community health. In 2023, however, we collaborated with Deutsche AIDS-Hilfe and their MSM team to organize the meeting jointly. And since then, we decided to do it together in the future. That 2023 meeting was focused on prevention and gay dating apps, which AIDS Action Europe has a working group on. And as a guest, we had the Grindr for Equality manager who presented the Grindr for Equality free messaging for NGOs, and we are still on it and keep working on making prevention on gay dating apps more, making it better and easier for organizations to reach the communities. And in 2024, we organized a meeting in Budapest, and the topic was standards of combination prevention with a focus on Central and Southeastern Europe. Next slide, please. We had, beside the main topics of the meeting, there were, of course, other topics in focus, and ChemSex was one of the big topics at both meetings. At the Budapest meeting, Nina presented our manual on harm reduction in the context of ChemSex, which I'm going to say something about a bit later. There was a lot of discussions on ChemSex research and how to collect data, but also about mutual learning between harm reduction providers who have services mostly tailored to the classic cis, straight, male injecting drug user, and service providers focusing on GBQ-MSM, who don't have as much experience with harm reduction services. And after the meeting, we also had a webinar, and part of that webinar was presenting the results of the AMIS 2024 study, the European MSM and Trans People Internet Survey, which is related to ChemSex and mental health. And I would recommend checking that out on our YouTube channel. We have a recording of that webinar. Next slide, please. PrEP was also one of the topics in focus, and Pietro Vinti from Milano Checkpoint, who's also a WHO consultant, presented this good practice example from Milan and shared some guidelines on how to design and evaluate delivery models for PrEP. And again, after the meeting, we organized a webinar with AVAC, our partner organization, and they spoke about HIV prevention in Europe with a focus on PrEP, especially the long-acting and injectable prevention options. Other topics we spoke about were GBQ-MSM sex workers, especially regarding the use of digital platforms. There was a good practice example from Portugal about training community health workers, and about combination prevention standards in SCOPE. And Chiara from SCOPE EATG presented the checklist that they are developing in the framework of that project. And Christos from AIDS Solidarity Movement had a short workshop on guidelines for developing online campaigns regarding GBQ-MSM health. Next slide, please. So now I'm going to talk about the capacity building activities in the context of ChemSex. And when we design our activities, we try to identify the gaps in the HIV response, and then try to fill the gaps with the skills available in our network. When it comes to chemsex, even though there is a lot of research and a lot of resources on chemsex, it is not very well structured or comprehensive. So we wanted to do sort of a compilation of the most important information on the topic in the training manual. There was a lack of skilled community workers, which led us to organize 2 rounds of the training of trainers. Due to insufficient funds, we gave small grants to our member organizations, and especially the representatives of our members who did the training, to either implement the trainings locally or translate the webinar in a local language. And because there was a lack of space for exchange, we organized several webinars on the topic. There is a special subsection on our website dedicated to chemsex, and there was a chemsex newsletter, which is still available on new psychoactive substances that are not covered by the manual. Next slide, please. So I'm going to say a couple of words about the training manual more in detail. It was authored by Antonis Poulios. Some of you might know Antonis. He also worked with AIDS Solidarity Movement. He's a psychologist and psychoanalyst from Athens who has extensive experience working among other people with people who engage in chemsex. He authored the manual in collaboration with Nina, who was also the project lead on this on all our chemsex activities. So to give credit where credit is due. Yes, the training manual is divided in 2 parts. In the first part, the definitions of chemsex and problematic chemsex involvement are presented, and there is some information, most commonly used substances, how they work, about overdose and harm reduction measures, and some core guidelines on best practice when delivering harm reduction services in the context of chemsex from community or organizations all over the world. And part 2 outlines a training workshop on chemsex and harm reduction. Next slide, please. The training manual is based on scientific and clinical resources, but also on the ground experience of Antonis and other organizations who provide these services. It is very flexible and adaptable to local contexts, but it is not exhaustive. It's rather a starting point for engagement with harm reduction and chemsex, but is in no case a final document on chemsex. It promotes person-oriented, cooperative, LGBTQ affirmative, and community-based services, and an intersectional approach to service delivery. In the second part, there are several case studies which can be used in the implementation of the workshop and which were also used during our training of trainers. The training course is interactive and encourages the use of analytical, critical, and creative skills, which means that the aim of the training and later the training workshops was not to create experts on chemsex, but rather to give community health workers a kind of framework on how to think about chemsex and how to approach people who need our support. And at the end of the training manual, there are resources for further reading. Next slide, please. About the training of trainers, we had 2 3-day training sessions, one in September 23 in Berlin and the other in June 24 in Athens. Thanks very much, Positive Voice, for providing the space and a lot of other support. In total, 27 trainees from 20 countries took part in the training. 2 of them were from AIDS Solidarity Movement. On day one, they were introduced to chemsex, substances and effects, and harm reduction interventions. Also important to note that the groups were, the second one maybe more than the first one, but they were mixed. So it was a mix of people who either have chemsex experience themselves or have worked with people who engage in chemsex before, but also people from member organizations who have never had any experience with the topic. On day two, the trainees were working on case studies that I mentioned before. And on day three, they discussed a guideline for developing services and implementing a training workshops in their local contexts. And there was some time at the end to exchange personal thoughts, experiences, and challenges, and to reflect upon the whole training session. Next slide, please. After the training, small grants were offered to our members. There were two types of grants. The first grant, Grant A, was meant for translating and adapting the training manual to local contexts, and it is now available thanks to our member organizations in 13 languages, and Greek being one of them. And Grant B was for conducting a training workshop. It was available only to the people who took part in the TOT. Before the implementation, we organized a webinar with Antonis, and we worked together to overcome the challenges regarding the implementation of the workshop in local contexts. In the end, 10 national training workshops were implemented, one of them in Cyprus. Next slide, please. Yes, there are, as I mentioned, there is a subpage on aidsactioneurope.org dedicated to chemsex, but also many more resources in our clearinghouse, news about our activities, and you can also subscribe to our newsletter, browse through the archive of what we've done so far, and feel free to message us anytime if you have any questions or suggestions. For this year, due to our funding situation, we won't be able to organize anything huge regarding network strengthening, capacity building, but there will be some online activities, and it will be great if you could join us in that. Thank you very much for your attention, and yes, I think we can end it here.
Great. Thank you very much, Ismar and Nina and Ferenc. Can I just say first, thank you for the absolutely amazing work that you have been doing, regardless of the situation, you know, with the funding and everything, but still, it's really, really important for us in Cyprus. And I think I speak for the whole team at the AIDS Solidarity Movement, saying that AIDS Action Europe has played a huge role in us being able to do this work, not only around PrEP and the advocacy that we have put, the efforts, the hours that we have put for advocating for PrEP in Cyprus, but also for other things like, you know, some of the projects that you showed and highlighted the participation of Cyprus. And I think it's, sometimes we don't say it enough, and it's really important to feel that there are colleagues outside the local context that can provide not only knowledge and expertise and maybe networking as well, which is quite important, but also support, like, you know, emotional support, you know, making us feel that we are not alone. So thank you for this. Let's see if there are any questions. I will stop the recording for now, and we will go ahead with a short discussion.